Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about metformin or glucophage. It's a treatment for diabetes. The compound behind it was actually discovered in 1922, and by 1929 it was found to reduce the blood sugar in rabbits. But because some other medicines were available at the time, not much work was done with this compound until the 1950s, when a Filipino physician claimed that the medication was bacteriostatic, could stop the growth of bacteria, stop the growth of viruses, kill the malaria parasite, could bring the temperature down in people who were febrile, and could treat pain. Well, this is the most widely used drug at the current time for type 2 diabetes. It's first-line drug according to the American Diabetes Association and the American College of Physicians, especially if you happen to be either overweight or obese. And it's used as an adjunct, of course, to diet and to exercise. And as a matter of fact, it's on the World Health Organization list of essential medicines. But we've known about the compound in some form or another for an awful long time, for centuries, because it's in the French lilac and it's also in goat's rue or Gallego officinalis. Comes in two forms, either the immediate release form, which was granted FDA marketing approval in 1995, or the delayed release form that was approved in 2004. Now, the medicine also is combined with a variety of other anti-diabetic medicines in one pill. So you can either take it by itself or take it in combination. Now, the dose is different depending on a variety of factors. So if we talk about the immediate release form, the maximum dose is 2,550 milligrams, with the minimum dose usually somewhere around 1,000 or 1,500 milligrams. And it's a trial and error approach. You take the medicine, check your blood sugar. If you need some more, you take some more. Well, the same thing with the delayed release form, except you start with a much lower dose, and then you gradually build it up. If you take the immediate release form, chances are you're going to be taking it 2 times a day. If you take the delayed release form, generally once a day, but if you're at maximum doses, maybe you take it twice a day. Now, it can be taken either with food or without food. If you take the immediate release form, only about 50% is going to be absorbed under any circumstances, and you reduce it by another 50% if you take it with food, but it's recommended you take it with food. The delayed release form doesn't make any difference. And there's a lack of proportionality. It is not necessarily the more you take, the better it is, the more your sugar goes down. There's some individual sensitivity. Now, you can take it by itself, or you can take it in combination with other medications. Certainly, if you're well controlled on your diet, you don't even need any medication. But sometimes you get some family or some friends coming in from out of town and you're going to spend a week going out for dinners and your sugar's going to go up a little bit, so you can take it transiently. You take it when you need it. Well, it can be taken when other medicines fail. It can be added on to other medicines. It can even be added on to insulin. And as a matter of fact, if you take metformin with insulin, chances are you'll need about 16% less insulin than if you weren't taking the metformin. Now, by itself, metformin does not tend to cause hypoglycemia, even if you don't have diabetes and take the drug. It doesn't do that. But unlike some other medicines that tend to make you gain weight, metformin does not tend to make you gain weight. It actually tends to make you lose weight and makes you a little bit more sensitive to insulin. Well, hypoglycemia is not generally a problem when you take this medicine by itself, but it might be if you combine it with other kinds of diabetes medicines, and in rare cases in individuals who are especially susceptible. So if you take the medicine by itself and you happen to do strenuous exercise, or you don't eat enough, you're calorically deprived, or maybe you're elderly, maybe you drink too much alcohol, you're debilitated or malnourished, you have some other kind of medical problem, then it's possible that your sugar can go down too much and you can become hypoglycemic. Under general circumstances, no. Now, let's say you have diabetes, your blood sugar, even on diet and exercise, is, let's say, 240 fasting. If you take the metformin, the fasting sugar could go down by about 50 milligrams. The postprandial sugar, the sugar after you eat, can go down by 80 milligrams. and your hemoglobin A1C, the glycosylated hemoglobin, go down by about 2%. So that's pretty good. And if you're taking an oral medicine, one of the standard, we call it sulfonylureas, let's say, and even though you're taking the glyburide and your sugar still is 250 fasting, if you add the metformin, you could find an additional 60-point lowering of your fasting sugar, your postprandial sugar, and your glycosylated hemoglobin could also go down substantially, almost 2%. Well, additionally, you get some benefits. Other benefits include it will bring your cholesterol down by about 5%, your bad cholesterol by about 8%, and your triglycerides by about 16%. Now, it's important to realize that the way metformin works is it decreases the amount of sugar or glucose that your liver makes. That's why, let's say you're diabetic, your sugar doesn't go down. I don't eat and my sugar doesn't go down. Why doesn't it go down? It doesn't go down because your liver is manufacturing sugar. In people with type 2 diabetes, the liver makes 3 times more sugar than it does in normal individuals, and the metformin makes it go back down to relatively normal. And in addition, the metformin increases the insulin sensitivity of your tissues, so your muscles, so the sugar that would otherwise not get into the muscle just stay floating around in the bloodstream. Now it has a home. It can get out of the bloodstream and into the muscle cells and the other tissues of the body. And additionally, if you take the metformin, it's going to decrease the absorption of sugar from the intestine. Well, it's generally well tolerated. You don't have too many side effects, except typically when you change the dose, when you start the dose, when you increase the dose, that's when you tend to have problems with this medicine. And especially with the immediate release form. The immediate release form can cause some diarrhea, nausea, abdominal cramps. It can cause some flatulence or gas and just kind of the blahs. If you look at the likelihood of diarrhea, it might be up to temporarily 50% in people who take the immediate release form. But if you take the delayed release form, it basically is the same as in the general population. And again, with nausea and vomiting, it's maybe as many as 1 in 4 people who take the immediate release form going to have at least temporary nausea, vomiting. But people who take the extended release form, again, falls down to a very low number. The likelihood of discontinuing the medicine because of side effects, well, if you're taking the immediate release form, it's maybe 5, 6, 7%, but only about 1% in those people who are taking the delayed release. Well, there's a problem that we all talk about in medicine, but it's really more of a discussion than it is a practical problem. What it is this thing called lactic acidosis. Lactic acidosis is where lactic acid builds up in your system, and that could cause problems. And it tends to cause problems if your kidneys don't work, if your liver doesn't work, if your heart doesn't work, you have congestive heart failure, especially if you're an older individual, especially if you're not getting enough oxygen in, so your lungs aren't working, and you're not getting enough blood to the different tissues. Well, we don't really know that there's a cause and effect relationship between metformin and lactic acidosis, but all doctors talk about it, and we all fear it because it can be a fatal problem. But the incidence of lactic acidosis is about 9 in every 100,000 people in the general population. And if we look at people who are taking metformin, it doesn't change. It's still the 9 in 100,000. But there is a relative, another biguanide, and we call it fenformin. You know about fen-phen, remember that old diet? Well, fenformin increased the risk of lactic acidosis up to somewhere between 40 and 65 per 100,000. So that's a potential problem. In studies on metformin, looking at 20,000 people, there wasn't even a single case of lactic acidosis, even though we still talk about it. Well, if you're taking metformin and you have a reason to become hypoxemic, your oxygen level goes down, or you get dehydrated, or you get an infection, you get septic, you ought to stop the medicine for a while. It seems that you need relatively normal liver function and relatively normal kidney function not to get this kind of a problem. And you shouldn't drink a lot of alcohol. And as a matter of fact, let's say you're going in for a CAT scan and you're going to have some contrast. Well, when they inject that contrast, that iodinated contrast into your system, it could harm your kidneys temporarily. So if you're going to have an angiogram or if you're going to have an IVP, you probably ought to stop taking the metformin, doctor's advice, of course, and you should probably stay off of it for about 2 days, and then your kidney's back to normal, and then you take it again. Well, the question is, what are the symptoms of lactic acidosis? They're absolutely non-specific. You just don't feel right. You got the malaise, you got the blahs, your muscles hurt a little bit. Maybe you're not breathing right, maybe you have some abdominal distress, maybe you can't sleep. Later on, your body temperature might go down, your blood pressure might go down, you could get a slow, irregular heartbeat. But those cases, as I said, are very unusual. Now, it also is used in polycystic ovary disease. Now, polycystic ovary disease is associated with insulin resistance. We've known that since the 1980s. And in 1994, a doctor in Venezuela came up with the idea, look, let's take some of these women with polycystic ovary who want to get pregnant, let's give them metformin, and actually it improved the fertility. Well, actually they thought, in the National Institute for Clinical Excellence in the United Kingdom, that it actually, metformin, was helpful for women who were anovulatory and infertile. But a couple studies in the mid-2000s showed, well, that probably isn't the case. And current guidelines suggest if you're a woman with polycystic ovary and you want to get pregnant, well, the treatment for you is clomiphene. It isn't metformin. But if you happen to have type 2 diabetes, and you happen to have the polycystic ovary, yeah, it's a good idea. Go and take the drug. Now, some other things that metformin could do. It could lower your B12 level. About 7% of the people get low B12 levels. Now, that's not a problem for people taking it for a little while, but after you've been taking the drug for years, you might want to have your B12 level measured. It doesn't usually cause anemia. It doesn't usually cause B12 deficiency anemia. But you still get a blood test at least once a year. And by the way, if you take either Tagamet or Keflex, it might increase the amount of metformin in the system. Now, there was an interesting study back in the 1980s and 1990s in Britain, and it was thought at that time, they call it the United Kingdom Prospective Diabetes Study, it was thought that maybe the metformin could reduce the likelihood of your having an adverse heart event. In other words, a heart attack or die of heart disease, if you happen to be diabetic and you were taking the metformin. Well, it was thought that at the time, but unfortunately, it seems like that's probably not the case. So it probably doesn't really protect the heart. And it was used as a treatment for a while for pre-diabetes. It was thought that if you were at risk for developing diabetes, what you could do is take metformin and you would reduce the likelihood that you would get diabetes. Well, the goal is, since most type 2 diabetics are overweight or just plain fat, it was thought that what you should do is you really should reduce your weight by at least 7% and get at least 150 minutes of moderately intense exercise per week. They did a study, diabetes prevention study, and they looked at people over a period of 10 years, and they gave them either nothing or metformin or lifestyle changes, and it was found that people who took the metformin actually had an 18% reduction in their likelihood in that period of time of developing diabetes. But the people who changed their lifestyle, who lost weight and exercised, they had more than a 33% reduction in the likelihood of diabetes. So probably taking it to prevent diabetes is not nearly as good as some proper habits, exercise, and weight loss. And then there's been studies of metformin, it seems at least in some preliminary studies, to help with non-alcoholic fatty liver, with premature puberty. It might slow the aging process, at least in the laboratory, at least in a type of a worm known as C. elegans. Might help in idiopathic edema, where people just develop some swelling of the legs for no reason. Helps in type 1 diabetes, even though it's thought to be a type 2 diabetes medicine. It might also help in type 1 diabetes additionally when it's added to the insulin. And there's a question about what does it do for cardiovascular disease. Now, more interestingly, the drug may have some chemopreventive action. It might actually help to prevent certain types of cancer. So it's been found that there's a decrease in the likelihood of colon adenomas, those precancerous tumors, by about 20–30%. Increase the survival in people who have cancer of the colon, some studies, by 20 or 30%. Decrease the incidence of prostate cancer, decrease the incidence of ovarian cancer and breast cancer and endometrial cancer. Seems to slow the proliferative process down. Now, all of that's preliminary, but at least there's some evidence that it may work. And most wonderfully, metformin is cheap. If you take the immediate release form, some places give it to you for free. Other places charge you up to about $12 for it. Maybe for the extended release form, up to $20. Well, the U.S. market is still robust, even though we hear about all these multi-billion-dollar drugs. This is the most widely used drug, and the total amount it brings into all of the manufacturers, less than $600 million. So they're not trying to rip you off. And as a matter of fact, there's still a lot of interest in metformin, even though it's been on the market for an awful long time. The last time the Food and Drug Administration granted marketing approval was just this past February 2017. So my summary on metformin is it's a very good drug. There's a low risk of anything happening when you take the drug. It's easy to take. And compared to all the other medicines for diabetes or almost anything else, this one has a very fair price. Thanks for watching. I'm Dr. Ken Landau.